If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center for vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Welcome, Q family. It's time for your favorite 15 diabetic-friendly minutes on 100.7 QFM with the compliments of the Barbados Diabetic Eye Screening Program, the Barbados Community Foundation, and the Maria Holder Diabetes Center. This is Peter Boyce here, and if you are diabetic or pre-diabetic, the next 15 minutes of health tips that you hear will be good for you, just like how Q is good for you too. Q is happening tomorrow, but the Maria Holder Diabetes Center, located in Warren, St. Michael, is open 5 days a week to give you access to the best diabetic medical care to keep you healthy so that you can attend all the Qs in the communities that you want to. At the Maria Holder Diabetes Center, you can find the best diabetic doctors like Dr. Diane Braffett. You will be hearing from Dr. Braffett with a health tip soon in this show, and she can be cracking a joke too, so listen out for that. You can also find diabetic nurses like Nurse Tracy Bushell, and you can also get nutritional advice or eating advice from a qualified registered dietitian, Miss Victoria Cox. When you are diabetic, you know you have to be careful with what you eat. Set up an appointment with Miss Victoria Cox at the Maria Holder Diabetes Center. And then there's also diabetic eye screening. If you are diabetic, you are supposed to be doing that every year. You get yours due yet? So what's stopping you? If you're one of those people that might be saying, I don't know about getting my eye screened, because I just be fighting for my skin. I don't like the pain. Well, to speak to that, we now go to Miss Renee Griffith, who actually administers the eye screening process when you go to the Maria Holder Diabetes Center. And we asked Renee, are eye screenings painful?
Diabetic eye screenings are painless. We take pictures of the back of your eye with a special camera. You will receive a copy of your eye screening report in a matter of 2 weeks after it has been reviewed and reported on. This report can also be shared with your doctor. In order to make appointments to be seen, person should call 243-EYES. That is the same as 243-3937. Bar members get 10% off. And just a reminder, you don't need a doctor's referral to get your eye screen at the Barbados Diabetes Center.
Thanks for reminding me about that, Renee, because I did forget. So those of you listening, make sure and make that appointment to get your eye screen for diabetic retinopathy at the Maria Holder Diabetes Center. And there you can also find podiatrist Louise Robinson doing foot screenings to keep your feet in good condition for line dancing at Q. But in case you might be one of those people that might be saying, but why is it so important for me to get a foot screening though? Because I just want to spend money on clothes. I don't have the money for the foot screening. So we asked podiatry assistant Alicia, how important is it for diabetics to get a foot screening?
So it's really important because it allows early detection of any problems that you have at all with your feet. And early detection and diagnosis normally results in more positive outcomes for you as well. It also allows us to work on preventative care. So say if you come in with excessive callus, then we can take that back a little bit, which will help your foot health as well. So there's a lot of things we can do to prevent more problems or any problems occurring. So I'd recommend regular foot screening appointments as well.
You mentioned adequate footwear. What is adequate footwear that you would recommend for diabetics?
Yeah, so for diabetics, because you might have a loss of sensation, it's really important that your footwear fits correctly. So you wear a shoe as well that supports your ankle, and this will stop your foot from sliding backwards and forwards. When your foot slides backwards and forwards, it can create a sore spot, which could create wounds as well. So it's really important that your shoe fits correctly. I'd always recommend a trainer that's comfortable as well. And also with footwear, it's really important that you check inside your shoes, because often if you can't feel your feet, say if there's a stone that falls inside your shoe or something like that, then that could also cause some damage to your skin. So that's a really important point as well. And it's important to have footwear that aids you in propelling you forwards during walking as well.
Why should diabetics moisturize their feet regularly?
So because sometimes you get reduced blood flow to your skin because it's the really small blood vessels that get damaged, it means that not enough oxygen and nutrients is going to get to your skin. So your skin will become more dry, and then that can result in cracks forming in your skin, which will lead to wounds.
Those are like cracked heels.
Yes, like cracked heels, yeah, exactly. So it's really important to moisturise daily if you can. That's most beneficial. But we always say make sure you don't moisturise between your toes, because that's already quite a damp area. We don't want to have excessive dampness, and to make sure you let the moisturiser soak in as well before you put any socks or shoes on.
If a diabetic is at home and they're just walking around relaxed, would they be able to walk around bare feet?
No, so we recommend avoiding just wearing socks or bare feet at home, simply because you're more at risk. If you knock your foot, you stub your toe, you might not feel it, and then you'll carry on, and then that wound could get worse as well. So it's really important to wear a shoe inside, preferably trainers again, but if not trainers, the next best thing, something that's comfortable, something that supports your foot. Yeah, we'd recommend wearing shoes inside if you don't have that sensation in your feet.
So what about if you're just going outside to do garden work, just in your own garden? Should you put on shoes then too?
Yes, you should definitely put on shoes then too, especially because there are a lot more stones, there are a lot more hazards. Yeah, even if you're going outside just for a short amount of time, I'd really recommend wearing shoes. But we're really friendly here. Like I'd really recommend coming in. If you've got any concerns at all, give the Diabetes Foundation a call.
417-0305 to make that podiatry appointment to get your feet looked at as we continue on the Maria Holder Diabetes Center Q radio show. Now it is time for Dr. Diane Brathwaite, and today Dr. Brathwaite will be giving us some diabetic tips, particularly targeted at older persons. But somebody like to tell Dr. Brathwaite that she family to Matt Fingal, so she will be opening with a joke.
So we always need that time off for a good joke, a little chuckle. And I have a joke that was sent to me this week. It made me smile. So the doctor said, "Why did you take your antibiotic medicine at 6 p.m. when I told you 9 p.m.? Patient's response, "I wanted to surprise the bacteria." I'm sorry, but I think that's really quite funny, actually. So remember to take your medication at the time you're meant to take it. There is a reason that it's spaced at specific times. My lady had good intentions in trying to surprise the bacteria and get rid of them, but remember to follow the directions, your medication labels. Okay, so moving on to another topic, which is very important, really. We wanted to talk a bit about diabetes and considerations in the older person, or maybe tips. So the first thing we're going to talk about is dietary advice. Do you as an older person need specific dietary advice? Some people may need special diets in addition to the diet that they're being recommended for their diabetes, or they may have digestion issues, or they may have issues with chewing. So dietary advice must always be tailored to you and what you need specifically, and also your eating preferences. So this is why we always recommend a consultation with a registered dietitian to get a plan that caters to you. Number 2, exercise. We know that exercise is a very important part of diabetes management, and really it's just beneficial for your health. As we get older, our muscles are going to shrink and atrophy. Our bones get weaker. They lose their density, become more prone to fractures and osteoporosis. Our ligaments get tighter. Everything changes as we change and as we age. So exercise can help to reverse some aspects of the aging process on the musculoskeletal system. But above that, it also helps to keep the heart healthier, stronger, will improve your breathing, especially if you have an underlying lung problem or an underlying heart problem. It can be of great help. And then most importantly, of course, exercise does lower the blood sugar independently of insulin. So that exercise, I always tell people that lifestyle, your diet and your exercise is actually the best pill that you can take. And then you see what medications are needed on top of that. Exercise can can look quite different. Everybody's not going to be able to walk 5 kilometers, but it can be gardening, it can be dancing, it can be swimming. Maybe you need to do non-weight bearing exercises instead of traditional exercise. Maybe you're in a wheelchair and you feel, but I can't exercise. Sorry, you can exercise. You can do upper body exercises. You can do seated exercises. And the honest truth is right now there is so much on the internet that you can pull down many types of exercise programs. Even if it's rehabilitative exercises that might come in the form of Pilates or yoga or something else, just keep that body moving.
Keep that body moving. You heard Dr. Diane Bradford right as we go into our Q song of the day as we get you in the mood for crop over. This is the Fraud Squad with Let Your Body Move. Like how Dr. D suggests, compliments the Maria Holder Diabetes Center.
I say let your body move. Music playing. I say let your body move. Tuesday morning. I say let your body move. Soca playing. I say let your body move. Put up your hand if you want walk. Put up your foot if you want jump. Put on your shades if you can look. Put up your wrist and stop. So jump like a trap. Walk up. Stop. You better do it again.
Keep that body moving.
Like a trap. Walk up. Stop. You better do it again. Shall singing, I say let your body move. Clear one watching, I say let your body move. Legend Sportsy, I say let your body move. Chinese laundry, I say let your body move. Put up your hand if you want walk. Put up your foot if you want drop. Put on your shades if you can lock. Put up your wrist and stop. So jump like a rock. Walk up. Stop. You better do it again. Jump like a rock. Walk up. Stop. You better do it again.
Keep that body moving.
The Maria Holder Diabetes Center.
You got to let your body move. Let your body move. You have to get in a go.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today.
We welcome Mr. Errol Griffith.
Thank you, Peter.
Tell us about your experience with the Maria Holder Diabetes Center.
My interaction with the Maria Holder Diabetes Center has actually been through Dr. Diane Bradford. She has such a heart for pure persons, and then the heart to see change as relates to diabetes, hypertension, etc. And so I've been happy to do everything that Diane has asked me to do.
So did you find that Dr. Bradford and the staff was receptive to all of your questions?
Dr. Bradford is receptive and beyond. Not only does she answer the questions, but she's always willing to give advice and make suggestions. And so my diet and my exercise are more consistent than they've ever been in my 58 years. So the center, including the nurse, in addition to Dr. Diane, has asked me to, if I'm going to go the route that I am seeking, to really and truly be very disciplined in my diet and my exercise.
So would you recommend persons visit the Maria Holder Diabetes Center?
Of course. I have absolutely no hesitancy whatsoever.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier
to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care.